Xenotransplantation and autotransplantation. Xenotransplantation of human tumor cells into immunocompromised mice is a research technique frequently used in preclinical oncology research. Human xenotransplantation offers a potential treatment for end-stage organ failure, a significant health problem in parts of the industrialized world. It also raises many novel medical, legal and ethical issues. A continuing concern is that many animals, such as pigs, have a shorter lifespan than humans, meaning that their tissues age at a quicker rate. Disease transmission and permanent alteration to the genetic code of animals are also causes for concern. Similarly to objections to animal testing, animal rights activists have also objected to xenotransplantation on ethical grounds. A few temporarily successful cases of xenotransplantation are published. It is common for patients and physicians to use the term allograft imprecisely to refer to either allograft to maintain the more precise distinction in usage. The first serious attempts at xenotransplantation appeared in the scientific literature in 1905, when slices of rabbit kidney were transplanted into a child with chronic kidney disease. In the first 2 decades of the 20th century, several subsequent efforts to use organs from lambs, pigs, and primates were published. Scientific interest in xenotransplantation declined when the immunological basis of the organ rejection process was described. The next waves of studies on the topic came with the discovery of immunosuppressive drugs. Even more studies followed Dr. Joseph Murray's first successful renal transplantation in 1954 and scientists, facing the ethical questions of organ donation for the first time, accelerated their effort in looking for alternatives to human organs. In 1963, doctors at Tulane University attempted chimpanzee to human renal transplantations in 6 people who were near death. After this and several subsequent unsuccessful attempts to use primates as organ donors and the development of a working cadaver organ procuring program, interest in xenotransplantation for kidney failure dissipated. Out of 13 such transplants performed by Keith Reimsma, 1 kidney recipient lived for 9 months, returning to work as a school teacher. At autopsy, the chimpanzee kidneys appeared normal and showed no signs of acute or chronic rejection. An American infant girl known as Baby Faye with hypoplastic left heart syndrome was the first infant recipient of a xenotransplantation when she received a baboon heart in 1984. The procedure was performed by Leonard Lee Bailey at Loma Linda University Medical Center in Loma Linda, California. Faye died 21 days later due to a humoral-based graft rejection thought to be caused mainly by an ABO blood type mismatch. Considered unavoidable due to the rarity of type O baboons, the graft was meant to be temporary, but unfortunately a suitable allograft replacement could not be found in time. While the procedure itself did not advance the progress on xenotransplantation, it did shed a light on the insufficient amount of organs for infants. The story grew so big that it made such an impact that the crisis of infant organ shortage improved. For that time, xenotransplantation of human tumor cells into immunocompromised mice is a research technique frequently used in oncology research. It is used to predict the sensitivity of the transplanted tumor to various cancer treatments. Several companies offer this service, including the Jackson Laboratory. Human organs have been transplanted into animals is a powerful research technique for studying human biology without harming human patients. This technique has also been proposed as an alternative source of human organs for future transplantation into human patients. For example, researchers from the Ganajan Research Institute transplanted human fetal kidneys into rats which demonstrated life-supporting function and growth. A worldwide shortage of organs for clinical implantation causes about 20 to 35% of patients who need replacement organs to die on the waiting list. Certain procedures, some of which are being investigated in early clinical trials, aim to use cells or tissues from other species to treat life-threatening and debilitating illnesses, such as cancer, diabetes, liver failure and Parkinson's disease. If vitrification can be perfected, It could allow for long-term storage of xenogenic cells, tissues and organs so that they would be more readily available for transplant. Xenotransplants could save thousands of patients waiting for donated organs. The animal organ, probably from a pig or baboon, could be genetically altered with human genes to trick a patient's immune system into accepting it as a part of its own body. They have re-emerged because of the lack of organs available and the constant battle to keep immune systems from rejecting allotransplants. Xenotransplants are thus potentially a more effective alternative. Xenotransplant